My name is Dr. Joseph Palmeri, and I'm located in Oklahoma City with Ethos Wellness Center. We're located about 30 minutes from the airport and with pretty easy access from most of the major venues and event spaces in the city. We offer regenerative wellness services, and we are very happy to begin offering RPA, regenerative protein arrays, as one of our modalities for helping with vitality, with healing, and with wellness. My background is an anesthesiologist. I trained at the University of Oklahoma. I did my residency at NYU in New York and returned back to Oklahoma after completion of that. But I've always had a interest in regenerative therapies. I initially went to medical school with the ambition of becoming a pediatrician. I hoped that I would be as authoritative as my childhood pediatrician was to my parents, and then that hopefully, if I was able to complete my residency in pediatrics, they might actually listen to me also. My focus shifted whenever I began my rotations as a pediatrician, recognizing that often the kids were essentially just given antibiotics and well child visits. There wasn't much impact that the pediatrician was having on the long-term outcomes of their health and wellness. Anesthesia was interesting to me because of the pharmacodynamics and because of the surgical encounters, the acuity. So I very much enjoy participating in that profession for 14 years now. But I've always had a personal interest in regenerative health and wellness. I've always been an avid exerciser, nutritionally, I was very discerning, took vitamins, and would always try to find different habits and therapies that would help me maintain high energy levels and health. And always had that personal passion and decided that at some point I needed to bring this into my professional life. And, the focus of most medicine, in at least the Western world, the allopathic world, seems to be on disease mitigation or symptom mitigation. And I'm more interested in being able to employ therapies and habits so that the body can heal itself and stay as well and vital as possible and reduce any need for medical therapies in a more traditional setting. So the regenerative protein arrays are probably the most effective tool in our tool belt here at Ethos Wellness Center, in that they're going to essentially provide a substrate for the body to utilize and a signaling mechanism for the body to utilize that were inherently part of our younger lives. As a young child, it's very common for us to know the healing potential of, a minor cut or scrape and how it seems to just vanish in a day or two versus as you get older, those things linger for significantly longer. So most of our patients come to us with, ambitions of trying to have more energy, to sleep better. They want to improve their neurocognition, maybe their sexual life. They want to lose weight. They may be getting older and having chronic inflammatory issues or chronic injuries. And the focus is generally in trying to help the patients to reduce whatever symptoms they're having through natural therapies like vitamins, exercise. We have IV services, we have peptide services, we utilize hormone replacement or optimization therapy. We also offer red light therapy, contrast therapy, which is inclusive of infrared saunas and ice baths. We also offer PMF therapies, and now RPA as an adjunct to all of those, or maybe even as a primary therapy. And in synchrony, combining these different values, they seem to almost force multiply. So it allows the patients to feel better with individual therapies, but in combination, it really seems to stack and provide even greater benefit than utilizing any of them alone. We'll have patients come in either in person or utilizing a telehealth visit in order to decide what their goals are of focus and then what types of therapies they're available to. We offer the RPA through different modalities. We are able to inject it intravenously. We can utilize intra-articular injections if somebody is suffering from a joint issue. And then as an anesthesiologist, I also have a tremendous amount of experience delivering neuraxial anesthesia. So that's going to be spinal and epidural anesthesia. So it's also very important for us to be able to apply the RPA therapy to the central nervous system. in a more direct pathway if we're working on patients who may have neurocognitive disorders or spastic movement disorders. So basically, we decide what the patient's primary focus is. We decide what the most beneficial route of administration will be. And then we'll do an initial screening visit and set up a 15 to 30-minute appointment where the patients will come in, they'll have their RPA treatment, and then they'll be able to go on about their day with little to no issue at all, being able to enjoy the sights around Oklahoma City. We'll follow up with them in a week. We'll follow up with them again in a month and in 3 months to see the progress and to track how they're doing, and also to check in on any additional therapies that we may have been combining with RPA. We are ecstatic to be able to provide this therapy as the first clinic in Oklahoma City. And as the first provider in Oklahoma City, it's my honor to be able to give this to the community and whoever is available to come see us in Oklahoma City. So again, my name is Dr. Palmeri with Ethos Wellness Center, and I'm very excited to provide the RPA therapy in our repertoire of services at Ethos Wellness Center here in Oklahoma City. And I'm very much looking forward to anyone who needs to contact us or wants additional information. They can go through our website to request an appointment. They can call our phone number, or they can also email us directly, and then we can start talking about the benefits and the uses of RPA therapy. Thank you.